Have you ever been fast asleep only to be jolted awake by a sudden intense pain in your calf? It's not a bad dream. It's not a loud noise. It's something very real. A sharp, cramping pain that feels like an electric shock. This is what's commonly known as a nocturnal leg cramp. It may seem harmless at first, but it could actually be a silent warning sign from within your body. More and more people, especially those in middle age and older, are experiencing these night cramps. Some only occasionally, others night after night. Many simply endure it thinking it's probably just old age. But did you know that this seemingly simple symptom could actually point to deeper issues, like mineral deficiencies, nerve problems, or even underlying conditions such as heart disease, diabetes, or kidney dysfunction? Many people think it's just a normal thing, but few realize that behind those muscle cramps could be a silent warning from the body. So what exactly are nocturnal leg cramps? Why do they keep coming back? And how can you stop living in fear of them every night? In today's video, we're going to uncover why you often get leg cramps at night, the surprising and dangerous causes you might not expect, and most importantly, how to prevent and treat this condition effectively. First, let me explain what nocturnal leg cramps really are, and why you should never ignore them. A cramp is a sudden involuntary muscle contraction that causes sharp pain and often makes it impossible to move the affected muscle for several seconds to even a few minutes. In older adults, cramps usually occur in the calves, soles of the feet, or toes, especially at night when the body is at rest. What's important to understand is that this pain isn't just a normal muscle twitch. It's a signal that your muscles are under stress. That stress could be due to poor blood flow, electrolyte imbalances, nerve issues, or even early signs of underlying health conditions. Many older adults report experiencing leg cramps almost every night, disrupting their sleep, draining their energy, and severely affecting their daily lives. These painful episodes often strike without warning, lasting from 30 seconds to several minutes, and leave behind lingering soreness that can persist throughout the next day. Even more concerning, chronic leg cramps can sometimes be linked to underlying issues like nerve disorders, vascular problems, or metabolic imbalances, conditions many people are completely unaware of. Yet, too often, these symptoms are brushed aside. People assume, maybe I just walked too much yesterday, or it's probably just a calcium deficiency, and continue enduring nightly pain without seeking medical advice. And that's the real danger, when the body is trying to speak, but we choose to ignore it. The question is, why do leg cramps tend to happen more frequently at night? And why are older adults especially vulnerable? It's not a coincidence that when the body is at rest, symptoms like muscle cramps, tingling, or aches become more pronounced. At night, your blood circulation slows down, body temperature slightly drops, and the parasympathetic nervous system takes over. This makes muscles more sensitive to any deficiencies, whether it's oxygen, essential minerals, or disrupted nerve signals. During the day, the body may mask these imbalances through movement and distraction. But at night, those hidden dysfunctions begin to reveal themselves. That's why many people feel fine during the day, but experience fatigue, pain, or cramps once the sun goes down. To truly understand and resolve this condition, we need to look deeper into the root cause silently undermining the body's balance, especially in middle-aged and older adults. That's exactly the issue I'm going to analyze right now. The cause of nighttime leg cramps in middle-aged and elderly individuals is not simply due to overexertion. In fact, it results from a combination of several factors, and without proper understanding, patients may end up treating it incorrectly or ignoring dangerous warning signs. One of the most common causes is an electrolyte imbalance, specifically a deficiency of minerals such as magnesium, potassium, and calcium in the blood. These minerals play a crucial role in maintaining normal muscle contraction and relaxation. When their levels fall below the necessary threshold, the muscles become more easily stimulated and prone to abnormal cramping. This condition is especially common among older adults who have poor diets, suffer from malabsorption issues, or are on long-term diuretic medications, which are often prescribed for high blood pressure and heart failure. In addition, dehydration is another commonly overlooked factor. When the body doesn't receive enough water, especially in hot weather or during periods of high physical activity, blood volume decreases, circulation weakens, and muscles don't receive adequate oxygen and nutrients, which can lead to cramps. Poor blood circulation further worsens the situation. This is particularly true for people with atherosclerosis, chronic venous insufficiency in the legs, or cardiovascular diseases, where the blood supply to the muscles is insufficient, increasing the risk of abnormal muscle contractions at night. This condition becomes more evident in individuals who lie in one position for a long time, don't shift during sleep, or experience shallow sleep. We also cannot ignore nerve damage, one of the most serious but often overlooked causes. People with long-term diabetes, a history of herniated discs, or lumbar spine disorders have a higher risk of peripheral nerve damage. When this happens, the motor and sensory nerve signals become disrupted, leading to uncontrolled muscle contractions and nighttime cramps. Certain medications used to treat chronic conditions can also contribute to nighttime cramps. Common culprits include diuretics, blood pressure medications, statins for managing cholesterol, and some drugs prescribed for Parkinson's disease or depression. These medications may affect nerve function or alter electrolyte levels in the blood. Lastly, we cannot overlook the role of aging. As we grow older, muscle mass gradually decreases, nerve function deteriorates, and the body's motor control systems become less responsive. This slows down the recovery process after muscle contractions and significantly increases the risk of cramps, especially at night when blood circulation naturally decreases. Once we understand the causes, we no longer see nighttime leg cramps as a random or harmless occurrence. Instead, they become a clear sign that the body is lacking something, experiencing imbalances, and most importantly, in need of attention and adjustment. The good news is, if cramps stem from electrolyte imbalances, dehydration, or a lack of physical activity, they can be effectively addressed through simple lifestyle changes. The key is not to ignore them or wait for them to go away on their own, but to actively take care of your body. Just imagine, each restful night of sleep is a precious opportunity for your body to recover, and putting an end to those painful cramps can lead to deeper, more restorative rest. So, where should you begin? What nutrients should you replenish? What should you do before bedtime to avoid those stabbing pains in the middle of the night? And when is it time to see a doctor? Let's move on to the next part and explore practical, effective solutions you can start applying today. Nighttime cramps are a symptom, but if you know how to listen to your body, you can absolutely prevent them proactively. Many older adults have seen noticeable improvement in this condition just weeks after making simple changes to their lifestyle and diet. Below are comprehensive yet simple and highly effective solutions. First, start by replenishing essential minerals, the foundation for smooth muscle function. Your body always needs elements like magnesium, potassium, and calcium to maintain healthy muscle contractions. Magnesium is found in abundance in seeds like pumpkin seeds, sunflower seeds, soybeans, and spinach. Potassium is plentiful in bananas, sweet potatoes, coconut water, and tomatoes. And calcium, crucial for both bones and muscles, can be found in milk, spinach, tofu, and small fish that are eaten whole with bones. If you regularly consume coffee, strong tea, or take diuretics, Be aware that your body may be losing important minerals without you realizing it. Increasing your intake of fresh vegetables and fruits every day is a smart way to restore that balance. Another commonly overlooked cause is dehydration. Water doesn't just cool the body, it also supports blood circulation and helps reduce muscle tension. When your blood becomes more concentrated due to dehydration, your muscles are more likely to contract abnormally. Make it a habit to drink about 1.5 to 2 liters of water per day, depending on your body condition and the weather. If you often wake up at night to use the bathroom, it's best to drink more fluids earlier in the day and gradually reduce intake in the late afternoon and evening. Sometimes, simply having coconut water or a light electrolyte drink on hot days or after physical activity is enough to help your body settle down. One of the simplest and most effective remedies is stretching before bed. Take 5 minutes each evening to gently stretch your calf muscles and feet. You can stand near a wall, step 1 foot back, and keep your heel on the ground. Feel the stretch in your calf for about 20 seconds, then switch sides. Another good move: sit up straight, extend your legs, and gently pull your toes toward your body. This helps relax the muscles before sleep. Many people also use warming oils or coconut oil to massage their feet and calves. This not only improves circulation, but also promotes relaxation and better sleep. Don't forget that your sleeping position can also be a trigger for nighttime leg cramps. If you often experience leg pain at night, try lying on your back with a small pillow under your knees or ankles to prevent your legs from becoming too tense. For those who sleep on their side, be careful not to keep your legs tightly pressed together or crossed for too long, as this can compress blood vessels and nerves in the legs. These seemingly small details can have a significant impact on the quality of your sleep and your muscle health. Another very important point is to review the medications you take daily. Many drugs used to treat high blood pressure, heart failure, diabetes, or high cholesterol can affect electrolyte levels in your blood, increasing the risk of cramps. If you start experiencing cramps after beginning a new medication, don't hesitate to talk to your doctor. You shouldn't stop taking your medication on your own, but you can absolutely ask your doctor to review it and consider adjusting the type or dosage to better suit your body's needs. And finally, know when it's time to see a doctor. If you experience leg cramps every night for an extended period, especially if they're accompanied by symptoms such as leg swelling, skin discoloration, numbness, or muscle weakness, these are serious warning signs. Such symptoms should never be ignored, as they may indicate vascular damage, nervous system disorders, or systemic metabolic diseases. Early medical evaluation can help identify the root cause and allow for timely and appropriate treatment, preventing the condition from progressing into something more severe. Every night, as you lie down and drift into sleep, your body continues to work, quietly healing, restoring, and if necessary, sending out silent cries for help. A sudden, intense cramp that jolts you awake in the middle of the night isn't just pain. It's your body's way of asking you to pay attention. Cramps might simply be the result of a long, tiring day, but they could also be an early warning sign of electrolyte imbalance, nerve damage, or an undiagnosed chronic condition. The key difference lies in whether or not you choose to take action early. You absolutely can take control of this condition. It starts with simple things: eating a balanced diet, staying well hydrated, doing light daily exercises, and being proactive with regular health checkups. Health is a long-term journey. It's not about quick fixes, but about consistent care, day by day, in the smallest details. Start today. Start by asking yourself, what was that cramp last night trying to tell me? If this video helped you understand your body better, don't keep that knowledge to yourself. Share it with 3 loved ones who might be going through the same thing, because you might just help them avoid a serious health complication down the road. And if you want to keep joining us on this journey of daily healthcare, make sure to hit like, subscribe, and turn on the notification bell. There are so many helpful and fascinating things waiting for you in our upcoming videos.